Today we welcome Will Smart, Alcidion's non-executive director based in the UK. Welcome to Alcidion's HQ in Melbourne, Will. Will, what role do you expect innovation to impact positively on patient care and clinical work environments?
I think we're seeing some really interesting developments. So, for example, ambient speech technology with EPRs. There's a real sense now when you go and see your GP in the UK or a doctor in clinic that they spend a lot of time staring at a computer screen and tapping on a keyboard and very little time looking at you in the eye and having a conversation in the way that when I was young, the GP or clinician would do. So I think those technologies will, I hope, bring the human back into the care process. So move the technology into the background rather than being foregrounded in the consultation. I think also, once we get that data infrastructure in place, we'll increasingly see that you won't have to keep reintroducing yourself and your health problems to every clinician that you see. That data will be available, and with AI tools, with clinical decision support tools, actually the clinician will be empowered to know more about you as an individual, but also more about the opportunities that there are to treat you as an individual that is more personalised and focused around you.
You've touched on AI a couple of times. Can you just perhaps expand on how you're seeing AI really benefit hospital care?
Since the last 10 years, I did work with Google DeepMind in the 2010s. We're really seeing massive advances around AI supporting diagnosis within pathology labs, within radiology. So I think we are now really reaping the benefits of new solutions that are driving better diagnostics and also driving innovation within medicines and within devices. We're also beginning to see AI-enabled decision support, and again, putting the options in front of the clinician in terms of what it is they can do. And again, I think that offers opportunities. That said, I don't think AI is going to replace doctors and nurses and therapists anytime soon. And in fact, there was an article, I think, last week where ChatGPT has passed medical exams but can't actually deal with a real world patient. So you still need that human interaction. So AI will amplify, I think, the skills that a clinician has. It won't replace them.
Quite specifically, how do you see clinical practice transforming alongside emerging technology systems in the next decade?
I think we are entering a really interesting world. So 10 years ago, I did some work with the charity in the hospital I worked with, which created a paper called Beyond Fog. So beginning to think about what would a truly transformed digital system look like, using wearables to actually be able to monitor the patient remotely, to see that care taken out of hospitals to be closer to the patient, to be more proactive, etc. So I think we're getting to the point where we will begin to see models of care begin to emerge that actually are based around the patient, will be proactive rather than reactive. And actually, we will see, I've thought, for example, hospitals as a model were developed in the Napoleonic era. So our model of care is hundreds of years old. We're about to see that upended, I think, and see care move out of hospitals into people's homes, and medicine will move come to the patient, not the patient to medicine.
Well, in your opinion, what should healthcare administrators consider when they're analysing the role of new digital health solutions?
Focus on the problem, identify the outcomes, buy the future, not the past. So buy solutions that are based on new modern technology standards, that are open, that use data standards appropriately. You mentioned integration earlier, that actually are capable of joining up the health system, not creating even more silos and walled gardens. And see this as a journey, not as a destination.
Yeah. Thanks, Will. It was great to chat today. It's always deeply fascinating to gain insight into how our key markets are embracing the digitisation of healthcare and clinical workflows. We really appreciate the time and expertise you are contributing to our team. A reminder that Alcidion is publicly traded on the Australian Securities Exchange under the ticker code ALC. Thanks for tuning in.